So the purpose of this video today is to discuss what's called the appendicular skeleton. Now, other videos that I have on YouTube talk about the axial skeleton, and the axial skeleton is what you would consider the bones of your body to be. So like the bones of your skull, your rib cage, your breastbone, and your sternum. In the case of your appendicular skeleton, it's divided into two sections, what's called the pectoral girdle, which are your shoulders, your arms, your wrists, your hands, and your fingers. And then your pectoral girdle, your pelvic girdle, which are your hips, your legs, your ankles, your feet, and your toes. Now, as I go through this, I always use the anatomy coloring book by Cabot. It is the 4th edition. You can see it has skulls on it. So you'll hear me referencing this as I go. But what I'm going to do is I'm going to walk us through the pectoral girdle first. I'm going to go from the shoulders down to the fingers. And then when I do the pelvic girdle, I'm going to go from the toes up to the hips. And the reason for that is we have the same number of bones in our digits in both our hands and our feet, and so they're given the same name. So just an easy transition as we're going up. Now, I usually don't have the video on when I'm doing this, but when I talk about the bones, there's certain features I'll be pointing out that goes along with the slides. So we're going to start with the shoulders first, and if you have the anatomy coloring book, that I have, it's page 29. Now, if you have a different coloring book, you can always Google different pictures as well that can help you label all these things. But what we're looking at here is a bone called the clavicle. And the clavicle is what you normally call your collarbone. It is kind of this irregularly shaped bone, and a lot of people don't realize it doesn't go straight across. And so we all have this little point right here. Okay? That is the end of your clavicle. And this picture is what letter C is actually pointing to. And you can take your fingers and follow the clavicle, and you'll notice it actually goes across your shoulder. It doesn't go straight, it goes across your shoulder. Because your clavicle at letter A articulates with your scapula, which you guys know of as your shoulder blade. Now this diagram is labeled, and if you have the anatomy coloring book, you can kind of label it along in that, or if you have a picture of the clavicle. But letter C, this portion right here, is what's called the sternal end of the clavicle. Sternal lets you know that this is where it articulates with the sternum. Remember, articulates means to form a joint, and so the sternal end of the clavicle forms a joint with our sternum, which is our breastbone. Now, letter B, as you guys see, there is a bump. It is a large bump. Okay? That is a tuberosity. It is the clavicle tuberosity. And then we have letter A. Letter A is back here on our body, and letter A articulates with part of the scapula. Now, the scapula has two trochanters on it, and trochanters, if you remember, are curved projections. They curve up off a bone so that muscles and tendons and ligaments can attach. Well, we have a trochanter on the scapula that the clavicle will articulate with. And letter A is what's called the acromion, or the acromonal end of the clavicle, because we actually have a trochanter of the scapula. When you have two different bones in a girdle, and a girdle would be like what you would consider your arms or your legs, if they have two things that have the same name. So for example, here, letter A is called the acromion. Well, when we talk about the scapula, you're also going to have an acromion. So the clavicle has a portion that we call the acromion, and the scapula has a portion that we call the acromion. That's where these two bones are going to articulate. That's where these two bones are going to come together. So like I said, if you have the anatomy coloring book on page 29, you can see how all this comes together. Okay. So this is what I'm focusing on right here. And I'm not going to keep showing the book, but just to give you guys an idea. Okay. But your clavicle, you have two of them, a left one and a right one, is what you commonly call the collarbone. And it articulates at the C end, that's the sternal end, and letter A is the acromion. That's what articulates with your scapula. And the scapula, as you know, is commonly called your shoulder blade. And we talked about how the reason why is there's actually evidence that ancient peoples use these as tools. Okay? They could actually, this part right here was labeled letter F in this drawing. That is actually a very sharp ridge. It's called a line, and they could use it as a knife to actually scalp. And scalp means to take the skin off of an animal. We have this pointy part back here, which is letter D. That was an example of a spine. That's a sharp projection. And then letter A here and letter B are these things right here. Okay? Those are all examples of trochanters. And remember, trochanters are curved projections that stick off a bone so that muscles and other things can attach to it. Well, your clavicle articulates with one of these trochanters. So in the case of your scapula, again, this is what you commonly call your shoulder blade. Okay? Letter D in this picture is an example of a spine. Okay, it is a sharp point. Letter F here is an example of a line. Letter H right here is a flat region. And it's flat because when you curl over like this tilts so that that flat crest rests up against your back. Now, this is looking at your, if I were to take your arm off, this would be the viewpoint that you have. And so this region right here, these are just examples of different males and female bones. But this region that I've just colored in red right there, that is an example of a socket. That's your arm socket of the ball and socket joint. And remember, sockets are called fossas. And this fossa is called your glenoid cavity. So your glenoid cavity is a fossa, which means it's a socket. It's also a condyle. It would have cartilage covering it in order to make it nice and smooth. It would be hyaline cartilage, which we call articular cartilage. You also on your scapula have these two trochanters. And you can see how one trochanter is positioned on top of the other. So we're going to call this trochanter number 1, and we're going to call this trochanter number 2. So in the case of trochanter, what I've labeled number 1 and trochanter number 2, these are, again, they're trochanters, which means they curve projections so muscles can wrap around them. Trochanter number 1 is what's called your acromonon or your acromon. That's the one that articulates with your clavicle. So the clavicle has an acromon end. Your scapula has an acromonon trochanter. And that's what number 1 is. Number 2 is a second trochanter, and that's called the coracoid process, C-O-R-A-C-O-I-D. I always remember because they're kind of one's higher than the other. I can't trust like so just remember alphabetical order A and C. So the A, the acromonon is on the top, and the coronoid is on the bottom. So again, looking at this, number 1 here would be the acromonon trochanter or process. This one would be the coracoid process. This right here is your glenoid cavity. It is your arm socket, so it's an example of a fossa. It's also an example of a condyle. Letter F here represents a line. It's a sharp, this is where the blade portion of the shoulder blade comes into play. This part right here, this flat region, is letter H over here. That's what's called a crest. Letter D is a spine. And then letter A and letter B are both examples of what we call trochanters. Now, so your shoulder is your clavicle and your scapula. We're going to move on now to the humerus, which is your upper arm bone. And you can also see this on page 29 in your coloring book. This is an example of a long bone, and it has certain features that we've talked about already. Okay. Letter G here is representative of what's called a diphaesis. Remember, a diphaesis is the shaft. And so we have 2 epiphysi. Remember, the epiphysi are the ends. So each of those would be an epiphysis. Now, where I drew the lines, if you remember, long bones have growth plates. And those growth plates are called epiphyseal lines. They're also called epiphyseal plates. And so some long bones have that plate at the top, and some long bones have that plate down at the bottom. So remember, what we call our growth plates are also called surgical necks. Now, in the case of your humerus, like your femur, this is the only bone in your body to have the ball of the ball and socket. So this portion right here, it's what letter A is labeled. That's what's called the head. And letter B right here is another special growth plate. Only your humerus and your femurs have that special growth plate. And that's called the anatomical neck. And that growth plate is there to allow the head to get larger while the socket gets larger, because we don't want a dislocation to take place. And when you have a fracture, the bone is broken. A dislocation, there's nothing wrong with the bone, but the joint is messed up. So you probably hyperextended a ligament of some type. But in this picture here again, letter G is what's called the diphaesis. Letter A is the head. Letter B represents the anatomical neck. And letter C would be about where the surgical neck, its actual growth plate, would be. Letter D is just an example of a tubercle, which is a small bump. But what I want to focus on is the bottom part down here, because the bottom of your humerus articulates with two different bones. You have one upper arm bone, but you have two lower arm bones. And those lower arm bones are the ulna and the radius. And if you have the coloring book, you can see this on page 31 in my edition of the coloring book. But if you feel your elbow, we all have this bump right here. That bump right there, that's what letter J is on this picture, what people call your elbow bump. But also if you pick your arm up, you can kind of feel there's an indentation right here. And if you lay your arm out, you can see there's an indentation in the crook of your elbow. Well, these indentions are fossas. They're sockets where these bones can articulate. So what you've always called your elbow bump is actually letter J in your picture here. And you can see that letter J, if you have the coloring book, is actually called your epicondyle. Epi meaning above, condyle meaning a smooth area for a joint. And letter M is a fossa on one side, and letter L is a fossa on the other side. And then you have letter H. So what we're looking at here, you have two bones that articulate with your humerus. You have the radius and you have the ulna. So I have to kind of talk about both of these bones at the same time that I'm talking about the humerus. Now, when you hold your hand up, okay, you have your pinky side and you have your thumb side. Okay. If you take your elbow, if you find your elbow and you walk up your arm, you end up at your pinky. That is your ulna. Your ulna is what makes up what you call your elbow. The ulna is the bone on the pinky side. The radius is the bone on the thumb side. Your ulna is the one that allows you to bend your arm. The radius is the one that lets you radiate or twist your arm. So they both have to articulate with the humerus. They form a joint with the humerus. Now, in the case of letter H, letter H here is what's called the capitulum. And the radius also will have what's called the capitulum. Capitulum is spelled C-A-P-I-T-U-L-U-M. And the capitulum is an example of a condyle, and it's going to have articular cartilage on it, and that's where the radius is going to articulate. Now, if you remember, the radius has that donut shape at the top. So if this were the capitulum and this were the radius, they're going to articulate, and then the radius can turn, and that's what allows you to twist your arms like this. M and L are examples of what we call facets. And the reason for that is if you look at the ulna, and I'm going to have the ulna in the next picture, the ulna actually curves. It has two trochanters, and it has to fit inside of two fossas. So when your arm's straight or when your arm is bent. And that's what M and L are referring to. I'm going to go ahead and mention it here, and then I'm going to show you the next slide so you can see how everything goes together. Letter M is what we call the olecranon fossa, and that is spelled O-L-E-C-R-A-N-O-N. It's the olecranon fossa because the ulna is curved. It has two trochanters, and this is what's called the olecranon process. What you call your elbow is actually the olecranon process of the ulna. So when your arm is straight, letter M is this indent that you can feel back here. So when your arm is straight, if this were the indentation, the olecranon fossa and the olecranon process come into play. And when your arm's straight, you have this dent in the front. Well, that's what letter L is. And this is your olecranon, this is what's called your coronoid fossa, C-O-R-O-N-O-I-D, because we have what's called the coronoid process. So let me get to what I'm talking about here. So this is your ulna. Okay, that is the bone that goes along with the pinky side, and you can see F and G. Letter F, the top part of the curve, these are both trochanters. Letter F is called the Olecranon process. That's what you think of as your elbow. So when you're feeling your elbow, you are touching letter F. That is the Olecranon process. So the Olecranon process of the ulna locks into the Olecranon fossa of the humerus when your arm is straight. When you bend your arm, letter G, which is the coronoid process, locks into the coronoid fossa of the humerus. So when your arm is straight, you can feel this indent right here. That's the coronoid fossa. When you bend your arm, you can feel this dent back here. That is your coronoid. I'm getting them all mixed up. That is your olecranon fossa. But what you've always called your elbow is letter F, is the olecranon process of the ulna. Now, also, we all have this bump right here. It's on your pinky side. And a lot of people call this a wrist bump. Well, if you put your finger on this bump and move your wrist, this finger doesn't move. That's because what you've always called your wrist bone is not part of your wrist. This little bump is letter H. It is the end of the ulna, and it's what's called the styloid process of the ulna. Okay. So what you've always called your wrist bump right here is not part of your wrist. It is the end of the ulna, and you can see it lines up with the pinky side. Now, like I mentioned, in the case of the and so the ulna is the one that lets you bend. It's a hinge joint. It's the one that lets you bend your arms. The radius is the bone that lets you rotate your arms. And the reason it does this is because letter A up at the top, letter A looks like a donut, and letter A is also called the capitulum. The humerus has a capitulum, the radius has a capitulum, and that lets you know that this is where these two bones come together. The capitulum of a humerus is a round knot, and then the radius is like a donut, and so it sits there and it allows your arms to twist. Letter B in this picture is representing the surgical neck. That's where the growth plate is. And letter C is what's called the radial tuberosity. The ulna and the radius sit side by side. And where the radial tuberosity is, it kind of puts space between the two bones so they don't grind up against each other. And you know that we have another bump right here. Okay? It's another what people call the wrist bump, but if you put your finger on it and you move your wrist, this finger doesn't move. Now you'll feel the skin and muscle moving, but the bone's not moving. That's because that is not part of your wrist. That is letter D here in this picture on the radius. That's called the styloid process of the radius. So what you've always called your wrist bumps are actually styloid processes. This one is the styloid process of the ulna, and this one is the styloid process of the radius. Now, in the case of your ulna and your radius, as we work our way down, we get to our hands and our wrists. And you can see these on page 33 in the 4th edition of the anatomy coloring book. In the case of your elbow, your ulna bends your arm. Your radius allows you to rotate your wrist. And they do lie side by side. However, your radius is the one that articulates wrist bones. And I have the wrist and the feet, or excuse me, I have the hand and the feet together because they are very, very, very similar. In the case of your wrist bones are what we call your carpals. And these are examples of short bones. And you can see here how they fit tightly close together like pieces of a puzzle. We have a lot of ligaments in our wrist bones. And remember, ligaments hold bones to bones. And when you sprain something, that's a dislocation. So when you sprain your ankle or you sprain your wrist, you have hyperextended the ligaments. Remember, the ligaments are made of collagen, so they're not going to stretch. You know, if you pull them out, they're not going to pop back to normal. And so when you sprain your wrist, you actually pull those ligaments and you pull those bones apart, which can cause those bones to start to grind up against each other. But in the case of your wrist bones are what we call your carpals, and you have 8 carpals per wrist. Now, likewise, the bones of your ankles are called your tarsals, and you have 7 tarsals per ankle. Okay. The reason for that is because we are bipedal. 2 very large ankle bones have fused together to form your heel. And the real name for your heel bone is your cancellous bone. And so your heel is actually not part of your foot, it's part of your ankle. And so you can see why I'm doing the hands and the feet together, because they're very, very, very similar. Because remember, our four-legged friends, our ancestors probably walked on all fours if you follow evolution. And so it makes sense that our hands and feet are very, very similar to each other. Now, like I mentioned, we have our carpals. You have 8 carpals per wrist. Okay? And you can remember Sally left the party to take Kathy home. That gives you a name of all the different wrist bones that you have. Sally left the party is your scaphoid, lunate, triquetrum, pisiform, to take Kathy home, trapezius, trapezoid, capitate, and hamate bones. In the case of your hand bones are what we call metacarpals, and you have 5 hand bones. They do not have separate names, they're simply numbered. Hand bone number 1 is the one that lines up with your thumb, all the way to metacarpal number 5, which lines up with your pinky. The same thing is true with your feet. In the case of your feet, you have what we call the metatarsals. So you have 8 carpals per wrist, you have 7 tarsals per ankle. So of the 206 bones of the body, 16 of them are wrist bones and 14 of them are ankle bones. You have 5 hand bones, that's 5 metacarpals per hand, and you have 5 foot bones. Those are your metatarsals. Now, the bones of your digits are what we call your phalanges. And you've been lied to your entire lives. You do not have 10 fingers and you do not have 10 toes. Okay. To be a finger, you must have 3 bones. To be a toe, you must have 3 bones. And if you'll notice here, the thumb only has 2 bones, and your big toe only has 2 bones. So you do not have 10 fingers. You have 8 fingers and 2 thumbs. That's why thumbs have a different name. Structure determines function. We have to give them a different name. You don't have 10 toes, you have 8 toes and 2 big toes. But your thumb and your toe actually have names. In the case of your thumb's real name is the pollux, P-O-L-L-U-X. And in the case of your big toe, its real name is your hallux, H-A-L-L-U-X. But the bones of your wrist are your carpals, the bones of your ankles are your tarsals, 8 and 7. The bones of your hand are your metacarpals, you have 5. The bones of your feet are your metatarsals, you have 5. And then the bones of your digits, your fingers, your toes, your hallux and your pollux, are your phalanges, and you have 14. So you have 14 bones per hand, you have 14 bones per foot. So of the 206 bones, 16 of them are wrist bones, 14 of them are your ankle bones, 10 of them are your hand bones, 10 of them are your feet bones, and then 28 of them are your finger bones, and 28 of them are your toe bones. So if I did the math right, that means of the 206 bones of your entire body, 106 of them are just your ankles, your hands, your feet, your toes, your wrist, and your fingers. So a lot of bones there. Now, working our way up. So in the case of your leg bones, like I said, we have the femur, the tibia, which is your shin bone, and the fibula, which is also a lower leg bone. But in us, it's pretty vestigial, which means it doesn't really have that much of a purpose anymore. And our four-legged friends, the tibia and the fibula are almost the same thickness because the way that their weight is bared. But in the case of your femur, it is the largest bone you have in your body. And you guys know that letter A here represents the head. That's the part that goes into the ball and socket joint. Letter B is the anatomical neck. That's that special growth plate that the femur has in order for the head to get larger. Letter C is the greater trochanter that we've talked about. Letter F is called the lesser trochanter, but in reality, it is an example of a tuberosity. Letter G represents your diaphyseis, and then H and I down at the bottom are two condyles that your femur has, because this is where the tibia articulates. So we have the picture of the shin bone, and you can see F and E. F and E are also condyles. Remember, condyles are smooth areas that are covered with hyaline cartilage where two joints come together. So H and I will sit on top of F and E. And H and I are what we call your medial and your lateral condyles. And they do articulate with the tibia, which is what you guys know as your shin bone. And again, letter D is called the tibial tuberosity, but in reality, that is a tubercle. And that is where some ligaments attach that hold your kneecap in place. Your patella is your kneecap, and your patella is to your leg what your Olecranon process, your elbow, is to your arm. It's there to protect some nerves and blood vessels that pass through. And then down at the bottom of the tibia, you'll notice letter A. Now my picture is kind of hiding the bottom of the fibula, but the bottom of the fibula has the same thing. And if you have the coloring book on page 38, you can look at the lower part of the leg. Now on your leg, what you've always called your two ankle bones, if you just kind of reach down, I'm not going to throw my leg up here, but if you kind of reach down, because I'm not I'm not flexible enough, but if you reach down and you touch what you call your two ankle bones, you have a lateral one and you have a medial one. Remember, lateral is going to be the one on the side of your leg, and the medial is going to be the one on the middle portion of your leg. But you have what you've always called your two ankle bones, one on each side. Well, if you put your fingers on those two ankle bones and move your foot, those bones don't move. Just like with your wrist bones or your wrist bumps, these two large ankle bumps, which a lot of people call ankle bones, they're not part of your ankle. They're what are called the lateral and medial malleolus. So your tibia is what we call the medial bone of your leg. It's on the middle, and the fibula is on the outside. So if your legs are straight out in front of you and you put your hands on the sides of your legs, you're touching the fibula. And if you put your legs, it's kind of an awkward position on the end. If you put your hands on the inside between your legs, that is the tibia. So the tibia is what we call the medial lower leg bone, and the fibula is what we call the lateral lower leg bone. And the tibia is the one that is the thickest. It's the one we put most of our weight on when we are standing up. So since your tibia is what we call the medial bone, this is what we call the medial malleolus. And again, my picture here is hiding the fibula, but the fibula also has a little bump down there, and it's what's called the lateral malleolus. So those are what we've always called your two ankle bumps. Now, in the case of your femur, so what we're looking at here are your hips. And with your hips, you actually have, there is no such thing as a hip bone. And you can see this on page 35 in the coloring book. What you've always called your hip bone is actually three different bones: the ilium, the ischium, and the pubis. Now, what we're looking at here are male hips versus female hips, and we'll talk about males versus females here in a moment. But with the case of your hip, we have right here what you would call your hip socket. That is a fossa. It is also a condyle, and it is what's called your acetabulum. The acetabulum is the formal name for your hip socket. Just like your arm socket is the glenoid cavity, and that's part of your scapula, the acetabulum is your hip socket. And it is larger than your shoulder socket because since we are upright walkers, we don't have to bear a lot of weight on our shoulders anymore, so that socket doesn't have to be as big. But your hip socket is actually made from the three bones of your hips. Now, the largest portion of your hip is like when you put your hands on your hips, you are touching this part here. If I can get a color that will show up. This part right here, that is a part, that bone is called the ilium. It's also called the iliac region. But when you put your hands on your hips, you are touching this top part right here. Okay? And that's what's called the iliac crest. And we talked about how it needs to be this nice, flat, smooth region so that when you walk and you move back and that tilts back and forth, you're not cutting the muscle that lays on top of it. The part of the hips that you're sitting on right now, this portion, let me get a color that will show up, this portion back here, That bone is called the ischium. It's also flat. It's called the ischial crest because you're sitting on it. Now, in you and I, again, our four-legged friends, they don't want that to be sharp. It sticks up because you don't want to cut muscles. But in you and I, we don't want it to be sharp because we're sitting on it. And then in the front here, this bone is called the pubis bone. There is no pubic bone. There's a pubic region, but we have what's called the pubis bone. So what you've always called your hip bone is actually three bones that have fused together. The ilium is the large flat part, like when you put your hands on your hips, you're resting them right here. And that's what's called the iliac crest. Then the part that you're sitting on is the ischium. And then in the front, you have your pubic bones. Now what you're seeing here, this right here is the end of your vertebra, and you're seeing the same thing in here. Okay? That's the end portion of your vertebra. That's your sacrum and your coccyx bone. But with your hips, we can, because females have to bear children, our hips form a little bit differently than male hips do. We have the same bones, but they're positioned a little bit differently. So I'm going to talk about that in this last slide. Okay. What you're seeing here is this artist, the photographer, has put rubber bands on the hips in order to help you see how the hips are held together. Now, in the case of humans, because we are upright walkers, our hip bones need to be stable. And so it's kind of hard to see, but they have rubber bands and this area that's blackened right here. Okay. Well, those rubber bands are holding the two pubis bones together. And in humans, we have a piece of cartilage that goes right there. Okay. It's black in this picture. Let me erase this so you can see it. It's black in this picture because there's nothing there. You're seeing the black backdrop. Okay. And so they're using these rubber bands to hold the two pubis bones together. But in us, we actually have a piece of cartilage that goes right here. And that piece of cartilage attaches our two pubis bones. And that piece of cartilage, you can see it on page 35 in your coloring book, is called the symphysis pubis. Without that piece of cartilage, we need that piece of cartilage. It's made from fibrocartilage. It's got a lot of collagen in it. It's really strong. We need that piece of cartilage so that when we walk, our hips have the ability to shift. If our pubis bones were fused together, we would not be able to walk as we know it. Now, our four-legged friends, a lot of them do not have this piece of cartilage between their pubis bones because their hips are further apart and they walk differently than we do. But when you look at the hips of males and females, we talk about something called aperture. And aperture is the overall shape of your hips. And so what I'm drawing here would be the aperture of the hips. And ladies, since we have to give birth, our child kind of rests in this region here. So we all know that females have wider hips than men do. Okay. So that's what they're showing here with these rubber bands, is they're showing the aperture of the hips. And you can see in this picture, this one here, we're gonna call that one number 1, and we'll call this one number 2. Number 1 is a female. Okay. The hips are wider in order to give birth. And ladies, I don't care what the doctors tell you, after you give birth, a lot of your pants are never gonna fit again. Because as the child gets larger, the child is gonna push your hips outward, and that's going to open up, that's going to stretch the symphysis pubis. And remember, it is collagen fibers, and collagen fibers do not bounce back to normal. So your hips do get wider after you give birth. That's why a lot of times they say that the second child is easier because the hips are already wider. Gentlemen have a more narrow aperture. So like this is another reason why there are guy pants and there's girl pants. And they're made differently because our hips are different. Okay? Girls, you can't go and put on a guy's pair of jeans. They're not going to fit the same way. Guys, you can't go buy a girl pair of jeans. They're not going to fit the same way. They are made differently because our hips are positioned differently. Also, not only are female hips wider, and guys have what we call a heart shape aperture to them, they also tilt differently. And that's what this picture here is showing. What you're seeing right here is the coccyx bone. That is the tailbone. And you can see how it curves. Well, ladies, we do give birth. And so when the child is born, the child actually passes through this huge opening. So the child would kind of come out. You can kind of think of it as coming out this way, okay? Because the vagina is back here. It's behind the pubis bones. And so the tilt has to be different in males versus females. And so what you're seeing here, what we'll call number 1, this is a female hip, and number 2 is a male hip. And you can see they're tilted differently by looking at the hip socket. In this case, notice the hip socket is tilted downward, and this hip socket is kind of out to the side. Well, in the case of the female hips, our hips tilt forward. Our hips will tilt forward in order to push the coccyx bone back. You can notice there's more space here than there is here. Okay. And the reason for this is as the child is being born or the child is developing, our hips are tilted in such a way that the child does not basically stab themselves on our coccyx bone. Gentlemen, your hips are more straight up and down because you don't have to worry about that. So ladies, our hips are tilted forward in order to push the coccyx. So if this were the coccyx bone, our hips are tilted forward in order to tilt the coccyx bone back. So during childbirth, the child doesn't stab itself. And ladies, you've heard some women when they are giving birth, they break their tailbones. Well, that's because they're applying so much pressure on this bone, it does break. But our tailbones, our coccyx bones are vestigial, which means we don't need them anymore. And so breaking our tailbone is not that big of a deal. And honestly, you're either so drugged you don't feel any pain, so you're not going to know, or you're already in enough pain, you're not going to know. So those are all the other bones of your body. And so I wish you good luck.